Hello, hi, my name is Yvette Rideau. I'm here in Congress to present my bioethic presentation. Um, my policy, the name of the policy in my program is Stopping Healthcare Disparities in the United States. The purpose of the program is to recognize the factors that influence the participation of healthcare disparities and how to stop it. Healthcare disparities have led to a gross miscarriage of inequity that has become an issue for the entire country. Healthcare inequity impacts African Americans and people of color that have been plagued by a gamut of healthcare concerns from maternal mortality, childhood asthma, infant mortality, organ transplantation, and hypertension. Explicit and implicit bias continue to be a force of the problem. They are fueled by discrimination in all areas, which inadvertently is derived from mistreatment. This mistreatment has led to low self-esteem and persistent stereotyping from the groups of racism. The program will assist African Americans and other groups as well. These groups residing in the eastern, midwestern, southern, and western United States. In summary, this program will address the issues affecting the groups involved and what key components can help to assist to improve inclusion efforts. The program is asking for assistance from the federal government and recognizing that the country has a problem with inequity in healthcare and society as a whole and will assist with solutions to stop it. There are many African American and Latino groups affected by discriminatory practices across the country. This is directed towards House of Representatives Charlie Rango and Senator Rand Paul of the U.S. government, Congress. Hello, my name is Yvette Rideau. Thank you for taking the time out to meet with me. I represent Southern California and Greater Los Angeles County. I work for Los Angeles Unified School District and University of California, Los Angeles. I have taken care of countless number of patients and students in the county. There are low income or those living at poverty level and do not have private health insurance and are on public assistance. My constituents are poor and have been faced with discrimination in healthcare stemming from mistrust and failures of the healthcare system that support and assist in their overall well-being. Healthcare disparities are apparent in healthcare and in mainstream America. Poverty, explicit and implicit biases are important variables that continue to perpetuate the problem of discrimination in this country. My program, Stop the Healthcare Disparities Advocacy Group, has been working and developing strategies to provide education and recognizing signs of implicit and explicit bias and overt racism. Many are low income. According to the California Department of Health, the rate of birthing people on Medi-Cal coverage was 26 per 1,000 births, per 100,000 births in the years 2019 and 2021. The partnerships have been formed with Los Angeles County Department of Health and the state of California to report infractions of racism so investigations can be initiated. Hospital administrations have set up continuing education programs for healthcare workers and physicians to take part in culture and sensitivity coursework to improve patient relationships during office encounters and in turn improve healthcare outcomes. Advocacy has been a major part to stop healthcare bias and helping uh, both parties aware of the problem so those affected will be comfortable. Our biggest asset has been to improve advocacy for marginalized groups, and this policy does coincide with my interest to put an end to racism and promote quality of care for all. We are still monitoring the progress on this matter. In essence, the organization will continue to fight discrimination of marginalized groups in healthcare. Hopefully, we'll combat the problem in education and housing as well. In conclusion, Stop Healthcare Disparities Advocacy Group continues to assist marginalized groups in recognizing discriminatory tactics. Many are poor or living at poverty level and do not have private insurance and are on public assistance. My constituents have been faced with discrimination in healthcare stemming from mistrust and failures of the healthcare system. They need support, assistance, and improving their overall well-being. Thank you for taking the time out with me.